Now, beyond the nutrition, of course, understand that in lifestyle medicine, we talk about not only nutrition, but the whole person holistically. What are other aspects of lifestyle change that you find so pivotal that people should embrace in their daily living?
Well, I might be biased, but I started exercising and doing some strength training in my early
Right.
40s because I started to become worried about, the loss of muscle mass that occurs as you age, and
Mm,
particularly as a perimenopausal
mm.
woman and going through the menopause transition, one needs to be very aware of bone health.
Yeah.
So I started doing that strength training in my early 40s, and I've been doing that now for a decade, and I think that has been incredibly important for my health. One of the most important things that I've ever done. So I always encourage people to move as much as possible, and I
Right.
think as we get older, particularly to pay attention to strength and resistance training, to make sure that you maintain your muscle mass and your bone mass as you age. And it's not just women, but men as well start losing bone mass and muscle mass, as they age. So it's important for everyone just to prevent falls and to make yourself feel more stable as you get older.
Definitely. Yeah.
Yeah.
And
And then there's stress. But yeah, sorry, carry on.
No. Yeah, you go.
Yeah. And then the other important aspect is stress. Again, drawing from my own lived experience, I was really burnt out as a junior doctor. I didn't even realize it at the time because I think we were all in the same boat. And it was only many years later when I was looking back, I realized how burnt out I actually was. And
Yeah.
I think many of my health conditions were probably made worse by stress. So I emphasize stress reduction as well with my patients. I was very fortunate to go on one of the very first mindfulness-based stress reduction programs that was held in Cape Town in the early 2000s. And so I continued to practice mindfulness as a way of helping me to manage my stress for many years. And then I studied mindfulness-based interventions at Stellenbosch University and started running my own programs in South Africa. And I find, yes, teaching people, helping them to bring in some short that they can use every day to help calm their nervous system down is very, very helpful. Helps them sleep better. Getting out into nature as well, exercising in nature, going for walks can be very therapeutic.
Wow,
Yeah.
that's very interesting. I didn't actually know that Stellenbosch offers that course as well.
Yes, they do. Yes, it's a postgraduate certificate course.
No. Yes, of course, we talked about, and of course, we started with the nutrition and then exercise and then stress management. Yeah.
Yeah, and
Yes, the other aspects, maybe two more, maybe before we move on for that part of the lifestyle medicine, of course, that I find very, very important.
you can't miss out sleep.
Of
Very,
course,
very,
yeah.
very important. And also just to realize how it affects your nutrition the following day. If you don't get enough sleep, you might have more of a tendency to want refined carbohydrates, and you won't be able to, and cravings. You won't be able to perhaps manage those cravings as much if you don't get a good night's sleep. And community, so important, social connections. That's what I love about getting my patients together in groups. I love the idea of shared medical appointments, of bringing people together, because community is medicine as well. People learn from each other. They are inspired by each other. So I love the idea of community.
Definitely.